Hello. The article that I chose to present today is about the privacy risks of health and wellness apps. And the reason I chose to do this article today is because I'm a big user of health and wellness apps. I wear an Apple Watch on a daily basis and it's constantly tracking everything I do. It tracks how many times I get up throughout the day, how many steps I take, if I went up any stairs. It tracks my sleep patterns at night, if I take any naps throughout the day. This is all very private information. And this is all based off of my own personal information that I manually put in, like my height and weight and my age. Also it could determine what my resting heart rate is. And what my heart rate is while I'm being active. And this is all information that I wouldn't think twice to share with anyone. It is, I think, very broad information. There are infinite combinations of height and weight and age, and that's just information that I don't care if it's out there. But there are apps out there that I've used personally that I wouldn't want that information out into the public. For example, I've used an ovulation app before, where it would track like my menstrual cycle and it would tell me when I'm ovulating, because I was trying to get pregnant. And, that might be information that I would not be comfortable with being put out into the public. And so this is what this article is focusing on, is these apps that are being used by and actually more frequently by patients, trying to take control of their own health versus going into a physician and having to pay all of this money out of pocket. They can just sit at home, put in their symptoms, and if it does get to a point where they're not comfortable with what they're seeing or what they're tracking, then they can go into a physician's office and see what's going on. So this study was done in the United Kingdom, and basically it's looking into these 79 apps that are accredited by the NHS Health Apps Library. And this library is supposed to comply by this Data Protection Act of 1998, and basically it's supposed to be like the most protective act of the users and the information that they've put into these apps. And so what they found was that a lot of these apps that are free are the ones to look out for, because it looks like they just don't care. They'll just put out people's information just about anyone, and specifically for advertisement purposes. So they'll use for example, Sally used this app to determine that she had breast cancer, and we can help you, get saved before you get breast cancer yourself. So, things like that. And then, so they found like the free apps are the ones to look out for. And then they looked at apps that people could pay up to $50 for. And those are the apps that are a little more protective of your information, because they have the resources to invest in a little more quality assurance. But again, these aren't the apps that a lot of people would prefer, because this is a way to save some money from going into a physician's office. So to pay any money for an app, isn't the best option, but those look to be like the best to look into. And like I said, these apps are being used more frequently now because physicians are asking patients to take control of their health. So you'll see that a lot of people are using them. They also found that any cloud-based apps had a critical privacy vulnerability, and this is information that is saved on a cloud, which makes more sense. It would be more prone to be released without authorization. And while they found that there was no malicious intent, basically the only reason they're using this information is for advertisement purposes to get more people to use these apps. So there's they're not really trying to get money out of you or anything, but it's information that if you really are uncomfortable with sharing with, like, your friend, obviously you wouldn't want it to be shared with anyone else. And this study also found that the user attitudes have also changed throughout the years. Just in general, people are more willing to share this personal information with just about anyone. So, which is why people are using these apps a little bit more, and they're just more free to use or to share this information on those apps, and they just don't think that this information won't be released. So that was basically the gist of the study, was that if you pay for your apps, you might get better protection than if you don't. But also they found that they have to have some kind of entity that is, overlooking or looking into the privacy acts of these apps, because people are using them more frequently. And actually, the last sentence I think would be great to close on is, if patients or the public are deterred from using apps because of questions of trust, then the potential clinical benefits of mobile health will not be realized. So again, this just goes to show that, the whole reason we're using this is because there is a benefit in being able to take over our own health and our health information versus, relying on a physician to do it for us. And so if we cannot trust these apps to keep our information safe, then, all the benefits of using these apps just goes right out the door.